You have recognized that a child is suffering from mental health issues. You have collected all the information and you're very sure that this is what is happening. Possibly the child has also disclosed to you because you've had a chat with them as part of your investigation. And they have said that, they feel sad all the time, or they feel fearful or anxious all the time. They can't sleep. They're not eating well. They don't want to come to school. They have told you all that is indicative that the child is experiencing mental health issues. Now you know. But how can you help them? That is what I'm going to be looking at now. The first thing to do is to develop a helping relationship with this child. For anyone who is experiencing mental health issues, the first thing that we have to do is to develop the helping relationship. And this involves listening to them, giving them the ear, being able to listen to what they're saying, and also to listen for those bits of information that help us to understand what they are going through. Listening is very important because then by listening, we show them that we care. We show them that we are there for them. We show them that they can turn to us when they need us. We also have to be empathetic. Empathy is important. We all pick on it. If someone, is empathetic, you know they are. And these children want to know that we are. We have to be empathetic when working with them, when supporting them. And we have to do this in a non-judgmental way. Probably they have been judged enough. It could be that these are looked after children. Or it could be that children who are being raised up in an environment of, gang lifestyle. And they have seen this over and over where they have been judged. It could be that these children are being bullied and they've been called names and they've been rejected. They need someone who is going to receive them in a non-judgmental way. So we need to be non-judgmental, and they need to know that. They need to be able to sense that they're not being judged, because then we'll build the trust and the foundation to help them. Another thing is the positive regard. We need to appreciate them. We need to look for the good things in them that they do not see probably. For instance, if they have issues with self-esteem or self-confidence, they might not be able to, pick up on the good things. We have to show that, and we have to be, positive around them. Also, we can help them by building up a social support system for them. Social support is important. As humans, we really thrive when we're among other people because we, benefit from energy from other humans. We need a sense of belonging. So it's important, say for instance, in a school setting, to build up this support system. I mean, this is something that has been done before. I have worked with children whom one of the interventions that we've used part of the interventions is being to pair them with another child. That can work very well because if we do, at least we've given them a friend. At least we've given them someone that they can turn to and have a meaningful conversation. At least we've given them someone that they can turn to when we are not available. So they need that support. We can also connect them with other teachers so that if we are not in school, they're not lost. We can connect them with the support staff, the teaching assistants, the student mentors, and the learner development team, the pastoral staff, the safeguarding team, all those ones, unless we can find someone or 2 or 3 people whom they can turn to if we're not there so that they're not lost. And they, feel the sense that there is someone there for them. Besides that, we are connecting them to the school anyway. Engage the family. It's, the school or the community setting or childcare facility, whatever it is. Bring the family and let them be engaged because this child is part of the family unit. If you cannot engage the nuclear family for one reason or another, because I've worked with children where the nuclear family cannot be engaged because, the child's problems are stemming from the family, then you can engage the extended family. Social workers are very good at doing this. They'll have the extended family, engage them to support this child, and use that holistic approach to support this child.